For me personally, I think improving someone's quality of life is such a noble cause because that means so much and is so special to each individual who's facing that detriment at that time.
When you go to work and it's your passion, it's because each day you want to drive yourself to push the world forward. And helping you to find who you want to be, that's what drives us here at Penn Surgery.
There are a number of wonderful features of plastic surgery at Penn. First and foremost that I think of is just a diverse body of faculty that are international leaders in their field.
You would be hard-pressed to find any other academic set of surgical training programs that have produced as many leaders as we have here at the University of Pennsylvania.
The field of plastic surgery is really a field that has grown from innovation. You know, just being here at Penn, some of the incredible things I've seen, we've participated in various hand transplants of children. We've separated twins born with fused skulls. We reconstruct breasts for women, suffering from cancer more than anyone else in the country.
We are the largest volume microsurgery center in the United States. We do more free flaps than any other program out there, and that's shown in our resident numbers when they graduate here.
We're surrounded by a lot of people who are motivated to define the future and to achieve excellence.
Penn really stood out amongst a bunch of other programs because our clinical volume here is exceptionally high. We have really complex cases, and the case diversity is also really high.
And you'll see everything that you could possibly imagine, from traumatic injuries to congenital deformities, and how to treat them and how to treat that diverse patient population.
We see so many different socioeconomic classes of people, so many different ethnicities, so many different cultures. I think that just adds to our individual empathy that we're able to express with our patients. You can't teach to care unless you can put yourself in the shoes of others who are not similar to you.
What most surprises me about being a resident here is how easy it is to get support in any sort of innovative idea that you have.
We have multiple research fellows that can help our residents really accomplish any project that they want. All our residents need is an idea.
Our approach at Penn Surgery is really to try to help people understand their own passions and motivations and unlock the skills and the tools that they need through both experiential and formal training so that they can go on to push the field. It's the people that make Penn Surgery and the ideas that the people bring with them. We are a family.
Over the past 5 years, the number of women in our program has increased tremendously. The number of people of color has also increased tremendously. And I think our leadership has really focused on reaching out to people from all walks of life. It's one thing to want people in your program just to have another face on your website, but it's another thing to show them that there's a particular reason why you should be a part of this group, and we value your opinions, we value what you're bringing to the table.
It's our culture of diversity, inclusion, and equity that allow us really to approach all of the opportunities that present themselves in surgery.
6 years is a really long time, and it's important that you surround yourself with people who are going to make that time fruitful and rewarding. And I think the group that we have here amongst the residents and amongst the faculty really, it's sort of this wonderful support system that really makes coming into work really enjoyable and really rewarding.
I love Philadelphia. It's an incredibly affordable East Coast city. There's so much to do. For me, I'm a big foodie. I really like the restaurant scene here. Having grown up in Cleveland, one tortured sports city to another, I found it right to be at home for me in a lot of ways.
Plastic surgery is unique in that patients can see the work that you've done, and because you're part of that process of them seeing a before and after, you become a real integral person in their life. The goal of anyone graduating from this program is to be able to have the skill set to technically, intellectually, and emotionally get a patient from point A to point B in their life.
By the time you leave, you're going to be an expert surgeon, and you're going to understand a philosophy of education, and you're going to have the ability to perform well in research. You really will be completely equipped for the rest of your career.